Doctors of Reddit, what's the biggest case of faking it you've ever seen? Story 1. Dermatologist here. Patient was convinced she had a melanoma and needed a biopsy and would need to be on workers' comp. I told her it looked like ink from a marker. She demanded a biopsy. I wiped the area off with an adult beverage swab and showed her the ink and that there was no spot on her skin anymore. She stormed out, threatening to sue. I'm just glad I cured her melanoma. Story 2. Pediatric neuropsychologist. Got a referral for more or less consolidation care. Patient was 13, wheelchair-bound, required therapeutic oxygen, seizures, arthritis, musculoskeletal problems, suspected autism, completely nonverbal, severe behavior challenges. The list goes on. He was being followed by at least 8 different specialties, clearly none of whom were communicating with each other. And MedList was 18 prescriptions long, including some incredibly heavy-duty stuff. Opioids, antipsychotics, anti-epileptics, that sort of stuff. Got kicked to me after his umpteenth ER trip because the ER doc felt something was off, and he needed someone to look at the whole picture. Factitious disorder by caregiver, or Munchausen by proxy. All of the original symptoms were parent-reported, going back to about a year old. It had possibly started with a febrile seizure, fever-induced seizure, in infancy, but this was never witnessed by anyone but Mom. It's unclear. She had been telling docs different things. She was convinced her son had all these disorders, told him he was going to die any day. He got a Make-A-Wish trip, donations, etc. He was removed from her custody and taken off most of his meds. Within a few weeks, he was out of the wheelchair playing basketball, no oxygen, super talkative and friendly, no behavior problems. He did have a pretty significant intellectual disability, but there's no way to say if that was organic or the result of the prescription cocktail he had been fed all his life. Hopefully, with some good therapy and a stable home, he can continue to make progress. Story 3. Source: am a practicing hospitalist physician. Faking it is real. It's most commonly seen in the ED, where folks want pain meds, or in the setting of underlying psychiatric disease. X200B. However, the interesting and not well-known feature of faking it is that it's a diagnosis just like any other condition or behavior. It has typical features, and if these features are violated, you want to be careful that you aren't misattributing the behavior. X200B. The most common incorrect diagnosis of faking it that I see as a hospitalist is psychogenic non-epileptic seizures. People will come in with debilitating loss of function that doesn't have the normal appearance of a seizure, will have a negative EEG, and will get told that they're faking it. In actuality, these folks have a poorly understood temporary loss of function that's every bit as real to them as epilepsy. It just isn't epileptic in origin. Establishing the diagnosis and having a conversation with the patient about the non-existent risk to them in these events is often curative by itself. You have to be really careful when deciding that someone is faking it. In my world, at least, it's often incorrect. Story 4. I'm a nurse. I work in acute rehab, so patients come to us to do physical therapy and recover from surgeries, illnesses, etc. Had a patient who played us good. So this dude was ready to go home and medically stable, but very, very anxious. He would always ask for me to recheck his vitals and blood sugar, always come up with new concerns like his hand is twitching, or he feels dizzy, or he's having blurry vision. I thought I was pretty good at ruling out his concerns and calming him down. Then one day I check his vitals, and his pulse is quite low, like 48. Everything else is good, so I'm not concerned. I tell him I'll recheck in a few minutes. I come back, and he's looking not so good. Pulse still low, oxygen quite low, and he's just woozy and slow to respond. I get my charge nurse in, and we're worried about an opiate overdose. We discuss this, and the patient's breathing gets slower and shallower. Call the MD. Give him some Narcan, call EMS. They arrive, and now he's nearly unresponsive, barely reacts to the sternal rub. They give him more Narcan with no effect, so now we're thinking, rule out stroke. He has the slightest droop on one side of his mouth. Was that always there? Darn, did I miss it? I give them report, and they rush him to the hospital, where they do a very thorough workup because he's high risk for a lot of issues. We followed up the next day, and nothing was wrong with him. The fudge must have heard me mention his pulse and said, "This This is my chance. I think he held his breath when I took his O2 sat and started dropping his mouth once we mentioned stroke. Probably skipped lunch since his blood sugar was low too, all because he didn't want to go home. Now, he's banned from our facility. Story 5. My brother was an EMT for 2 years, and he told me this. People will try to use the ambulance as a means for transportation from Fulton to Oswego, because the hospital is in Oswego, by faking seizures. Sometimes when the head EMT guy was feeling fun and knew that the person was faking, he'd say something like, "Man, it's weird that he's having seizures but not peeing himself." Apparently the person would kind of snap out of it for a second, weigh up the repercussions, then either pee themselves or stop faking. I thought that was hilarious. Answer. We had a family calling for a Medicab, a cab paid for by income-based insurance, from somewhere out in the sticks to our ER in a college town. Every few weeks or so, the mom would be seen for some ailment or the other, and the rest of the family would go to Walmart, go to the mall, do all their in-town errands. She was basically faking an emergency illness every few weeks so they wouldn't have to pay for a cab to get their shopping done. Story 6. Mom's a nurse. She had someone walk up to the counter, definitely on downers, all slurry and slow. Just starts talking casually about how she's in so much pain and needs painkillers. From what I understand, it's a pretty normal occurrence. On the other hand, my girlfriend had 8 teeth extracted at once and got interrogated when picking up pain meds 3 days after surgery. Also have a friend with severe back pain from an age-old injury. He has a lot of trouble getting meds despite trying to make them last as long as possible. Story 7. Late to the thread, so this will probably get buried, but I'm a resident, not a psych resident, but this happened in my psychiatry rotation in medical school, when I was in medical school. There was a patient at an inpatient psychiatric facility for tragic end ideation. She constantly insisted that she had a mass on her breasts and demanded to be physically examined only by male doctors. When the psychiatrist I was rotating under declined to perform a physical exam, she asked me to do it during my daily patient interview. I also declined physical exam, but had a bit of a hunch to check her medical records. It turned out she had an ultrasound done a week before that found only normal breast tissue without masses. However, apparently this lady had frequented many doctors' offices with various complaints of an unspecific nature and would usually focus on breasts or vaginal complaints when she visited male physicians' offices. We diagnosed her with factitious disorder, formerly known as Munchausen syndrome, and histrionic personality disorder. It seems her goal was mostly attention from medical professionals. She had lots of issues. But we also had to be careful to make sure she wasn't fishing for a lawsuit. Patients like her are why doctors document everything meticulously, so the patient wouldn't admit to making things up all the time. According to the psychiatrist I was working with, she didn't actually believe any of her health problems exist, and her primary goal was the attention from medical professionals. If she actually believed she was sick, we would have diagnosed her with illness anxiety disorder, commonly known as hypochondria. Answer. My mom had a roommate who would fake heart issues when she was bored because the EMTs are so cute. Mind you, both women were in their mid-50s. When they showed up to assess the faker, my mom was so disgusted that she pulled one aside and let them know what was up. They then took the roommate to the nearest psychiatric hospital for an evaluation. I think she was forced to hang out there for a week. They don't live together anymore. Pretty proud of my mom for that. Story 8. Mom was complaining all day about abdominal pain. It proceeded to get worse, so my dad and I drove her to the ER. We get to the front entrance of the ER, and she proceeds to rip the loudest fart ever. Not really a faking pain type of thing, but it's funny. Story 9. I work in occupational health. I'm an athletic trainer, not a doctor, though. I once had a guy come in complaining of back pain. He hobbled into my office, walking 1 inch at a time and groaning in pain. I knew he was faking it when I hardly touched 10 different areas on his back, and he howled in pain. I looked out the window to my office and saw about a dozen baby turtles crossing. I called out for him to come look. He jumped off the massage table and sprinted over in awe of the baby turtles. I told him to get back to work. Story 10. When I was a kid, I used to fake sick for no other reason than I wanted to stay home and hang out with my grandpa. He knew exactly what I was doing and would 90% of the time make me go off to school. We lived with him. Every so often, though, he'd wink at me, and we'd convince my mom I was feverish, and then spend the day together watching movies and being best buddies. I was like 9 or 10. I cherished those days because he passed away when I was 19, now 31. I would give anything for one more of those days. Story 11. Fourth-year medical student. On my ER rotation, and a trauma came in from a woman that had been arrested. During the drive, the patient banged her head 4 times against the window of the police car and then went unresponsive. She came to us with a bruise over her forehead and unresponsive. We all smelled BS, but the patient was a great actor. Didn't even flinch during the digital rectal exam, which is standard for all patients that come in through the trauma bay. Though some of the nurses said that they caught her peeking at us when he would leave the room. We ended up getting a CT scan, which was normal, and was even considering intubating her to secure her airway when our attending finally walked over to her, opened her eyelids, and held them open while telling her to wake up. Finally, she started fighting to close her eyes, and the jig was up. The doctor called her out, and she proceeded to start screaming at us. She was much more pleasant when she was pretending to have a brain injury. Answer. Funny story. When I went through EMTB training in California, we had an ex-Delta Force medic lead our trauma segments. He'd have us check for the normal things on our physical: deformities, contusions, abrasions, penetrations, punctures, burns, tenderness, lacerations, or swelling. DCA PBTLS. Well, he also had us check for anal seepage. We all took him very seriously. Towards the end of the trauma segment, he couldn't be there, so the primary guy leading the class had us go up and demonstrate a trauma check on an unconscious patient. I get called up to the front of the class first, perform all the normal DCA PBTLS shoot, then check for anal seepage. Guy leading the class stops me right there and is like, "Are you fucking kidding me? Moore has had you doing this again? You don't need to check for anal seepage. Fucking fuck again." Edit. Guy leading the trauma thing played a 2-month joke on us that we all took very seriously because the guy was not the kind of person you'd want to question. Story 12. A few years ago, I disliked my boss, so I would have lots of migraines. Headaches too severe to head into work. After seeing the same doctor a few times, he referred me to get a MRI brain scan. I played along. 3 hours later, I was rushed to ED at my local hospital due to having 2 lower brain aneurysms. I never had those headaches. I was faking them. Bit of a blessing in disguise, I suppose. Story 13. Dang it! I've been waiting for this, and it'll probably get buried because I'm late. 13 to 14-year-old girl came in for spontaneous bruising and pain in her medial ankle calf. Symptoms come and go sporadically. Mom was really concerned. No trauma history. Look at the leg. The bruise was shiny shimmering. I grabbed an adult beverage-soaked gauze and wipe off the graphite from a pencil. Girl was mortified. Mom embarrassed. Obviously done for attention. Strongly recommend a psychiatric evaluation to mom. Story 14. Sorta along the same idea. Working at a pharmacy, we saw a guy come in to try and get a refill on some pain meds that had no refill. After pleading that his ear really hurt, we told him again we couldn't refill it. One of the other employees saw his step into a side hallway and take a pencil and jam it forcefully into his ear repeatedly, drawing blood. He calmly left and went to the ER. He came back a few hours later with a prescription for pain meds. Answer. I ambulance transport a guy to ED on occasion that always has injuries and always has some nebulous, unclear reason for how he sustained them that basically screams self-harm in order to receive pain relief. Last time I went to him, he'd been run over by a car. Turns out, the car in question was his car and was parked out front of his flat. He had obvious swelling and abrasions on the knee, so definitely had an injury, but whether it was the car that caused it or not, who can say? So how did it come about? Well, he says he was actually servicing the car and had it up on a jack, and it fell on him. How did he come to be under a car when it fell and landed entirely on his knee and nowhere else on his body? Well, he was checking the brake pads and couldn't be bothered walking around the other side of the car and taking the wheel off, so he crawled under the car to get a look at it from behind to see if they needed changing, and then the car mysteriously fell off the jack and landed on his knee, and knee only. Then how did he get out? Oh, easy. The car rolled off him immediately, and he crawled out. So we treated his pain. He had an obvious injury. This guy was getting an ambulance transport once a fortnight for injuries that meant he was either the unluckiest and/or the clumsiest motherfucker alive, or he just really liked morphine. He had steam burns from a burst pipe. He had a microwave fall on him. All kinds of crazy shit happened to him, all on a fortnightly basis. Story 15. Young, 18 to 20, woman, went running into small rural hospital ER pretending to have abdominal pain. Police officer had tagged her going 40 kilometers over the limit, which was stunt driving as per the new law in Ontario. Impound and license suspension automatic. Cop followed her into ER and apparently said he'd be waiting for her when she left. Locum staff, such as myself, were housed at a small BB about 15 minutes away, and the ER had pre-printed order sets to be done before we arrived. When I arrived, she flat out admitted that she just came in because she freaked out and didn't stop. I told her we'd give her 45 minutes to call her parents' family before I booted her. Except BHCG came back positive, and subsequent ultrasound came back showing extremely early ectopic. Officer figures out something is up when he hears air ambulance call come in over radio. She was completely asymptomatic and just worked out that she dodged both charges and a life-threatening issue by accident. It was definitely a WTF moment. Edit. Well, this blew up overnight. I got a few messages. A little more info. Small rural hospitals in northern Ontario often service areas from more than an hour's drive away and still only have a catchment area of 2,000 to 3,000 people. When on call, it was just that. We would do our days in the community clinic, then maybe hospital rounds, then go home and be on call. We wouldn't be at the hospital. There wasn't an on-call room where you would stay, for example. There were lots of times that you'd go a full night without being woken up, or maybe just a call from the acute care inpatient wing. Locums were short-term contracts for places that didn't have full-time medical staff for whatever reason. It's hard to attract clinicians if you don't even have broadband internet in the community. They generally pay very well. Answer: reminds me of an old post where some hobo came to the hospital speaking incoherently, and they decided to give him a checkup anyway to show to the students. It was a university hospital, and he turned up to have some issue with the liver. After they treated him, he became lucid, and turns out he was a professor on his way to a lecture when his liver stopped functioning properly, and he couldn't think clearly because of that, so he was just wandering the streets for a while. Story 16. NAD. But I heard a story of a local prisoner who came in complaining of sharp pains in his stomach. He claimed he swallowed a nail. X-ray indeed showed a small nail lodged in his body. Turns out he taped it to his back. Wasn't trying to trick the doc, just needed some fresh air apparently. Story 17. Prisoner came in with signs and symptoms of a big stroke. At that time, the protocol was to get a non-contrast head CT to rule out a bleed, and then give TPA, a powerful clot-busting substance that's only worth the risk if the benefit is to mitigate a major stroke. So that's what happened. Later in the course, he got a little carried away and started embellishing his story with symptoms that didn't make sense with his stroke diagnosis. And that's how we figured out he was faking it, just to get some time away from jail. Story 18. Years ago, I had a patient who had been rear-ended in an auto accident a few weeks before I saw her. She had a history of lupus. She was decked out in the usual "I'm crippled" paraphernalia: crutches, neck brace, elbow braces, wrist braces, knee braces, and could barely walk. I saw her a couple of times, and she showed no improvement. One Saturday, I was on call but had to take a back streets route to the hospital, because of an event taking place on the main thoroughfare. I apparently drove through her neighborhood because, wonders behold, there she was, wearing old lady spandex, power walking down the sidewalk, holding weights in both hands. I did not call out to her. Next week, she was back in clinic with her "I'm crippled" get-up on again. A few weeks later, I got the subpoena for the deposition, and it all became clear. Story 19. No doctor, but a funny story from work a couple years ago. Guy calls in sick for around 8 days. Says on the phone he is really sick. Comes back to work the next week, tanned as FCK. This dude hands a medical slip to the manager written in Spanish. On the slip, there is an official seal from some random Cuban clinic. Guy walks over to B with a grin on his face saying, "Yeah, I'm probably fired." He was fired. Story 20. When I was a kid, I learned I could fake sick and get out of school. So 1 to 2 days a week, A would get a migraine and hold my head and complain, and I would get to go home. Eventually, my parents took me to a neurologist who said, "Maybe you just don't let him eat chocolate and sugar?" I admitted to faking and was grounded for a long, long time. Answer: I grew up the opposite way. I would get 3 to 4 migraines a week, but everyone thought I was faking it because most days I seemed fine, just because I was learning how to deal with them and try to act normal. It wasn't until 8 years after they started that I went to a neurologist who said I have chronic migraines, which I dealt with unmedicated for 16 years. Now I'm on medication. I feel like my childhood was partied too hard. Edit. I've replied to a lot of you nice people, but I'm on mobile and it will only load like 200 replies, and I can't view any more to reply on. But I like reading your responses. Much love to you all. Story 21. Anybody ever had a case of, this person is probably just faking it for opiates, that turned into a real case when the patient refused opiates? I overheard something to this effect when I was waiting to give a ride to a coworker. The patient was complaining of severe lower back pain, and apparently his x-rays were clear. The nurse was telling him as much, but he kept asking her what other tests they could run, and if they could do anything for the pain. He explains that none of the OTC stuff he tried was working. Red flag. Nurse flat out tells him that they don't prescribe oxycodone or similar without a clear diagnosis, but unexpectedly, the guy doesn't throw a fit, says something to the effect, "I understand why not. I wouldn't touch that stuff myself." Is there a surgery or something you can do to deaden the nerve, though? Or like, zap it? It's eliminate me. This prompts a sudden review. Blood work strongly suggests kidney stones or cysts, and last I heard, they were going to take him for ultrasound. The nurse's attitude changed so fast when he begged for surgery over meds, you could hear it in her voice. She was a million times more sympathetic, helping him roll over to get ready for the ultrasound, than telling him his x-rays were clear. Story 22. This patient comes in for back pain with weakness of the legs, gets a full workup with MRI, standard blood work, and then some immunological things to look for stuff like myasthenia gravis. No neurological or immunological explanation for the weakness. Patient is seen by physical therapy, and they are of the opinion that the patient is holding back intentionally. Go to see the patient at the end of the day and prep them for discharge. Patient is infuriated that they're being discharged, yelling and screaming about how they aren't better, how they're disappointed in the institution, blah, blah, blah. They said one particular thing that still clearly stands out 3 to 4 years later. "I can't believe you're sending me home already. I haven't even told my family I'm here, and now you're going to send me home before they even have the chance to see me?" My attending and I leave the room to arrange things with the nurses. We go back in and the patient is out of bed and standing up in the middle of the room. Miraculously, the patient is able to walk with zero assistance, when they had so much difficulty with any assistance over the previous 2 days. At that point, they were enraged. We went into the room without knocking. Story 23. When I was at boot camp in the military, I am in Europe. We were having a 1-week survival drill outdoors in the wintertime. This was in the Arctic, so you knew it was going to suck. A buddy and me decided to report in sick with fever and went to the infirmary. Young civilian nurses did the triaging. One by one, we were sent to a room with an old-school thermometer covered in plastic and lube and asked to insert it in the backside. She left the room, giving us a few minutes to insert it ourselves. That gave us a minute to take the thermometer out of the plastic sleeve, warm it on a light bulb, and then desperately shaking it when it spiked beyond human temperature, getting it down to a reasonable fever temperature, and put the sleeve back on before the nurse returned, and we had proof we had a fever. We both did it, and it worked. We had a few great days in the sickbay getting pampered by nurses, joking around and flirting with the nurses as awkward as 18-year-olds does. Every morning, the doctor made his rounds, so we repeated the thermometer routine and blew hot air into the pillow to warm up our foreheads so they were warm and sweaty until Thursday morning. The nurse came in, gave us the thermometer as usual, and said the doctor would be visiting in a few minutes. On her way out the door, she smiled and added, "And by the way, guys, if you still have a fever, you will not be released until Monday because the doctor has the day off on Friday, and there are no doctors here on weekends." We were miraculously fever-free and healthy again, and were dismissed that morning in time for the weekend leave. Thinking back on this, we were young and just wanted a few days away from the monotonous training and cold. And I still sometimes send a warm thought to that nurse, who obviously knew we were faking it, but played along. Story 24. Was told this one by a fellow nurse I used to work with when we had a psych floor. It's not unusual for psych patients to stash things in various orifices. This one woman was convinced she was impregnated by a ghost-like figure, but no one would believe her. So one day, she started complaining of massive pelvic and uterine pain. She called them contractions. So the doctor goes to do an exam. The doctor feels something larger in there, so they prep a table to get the object out, which was quite large. So the wonderful third year, helping with the procedure, starts hearing this woman complain of contractions and yelling things like, "Should I push? I'm gonna start pushing!" Doctor, trying to work forceps around this woman's parts as to not hurt her, finally goes got. And as he starts saying it, he pulls out a baby doll, head only. The poor med student did the wobble, went all flush, had problems keeping balance, and about took a dive. I was told he didn't live that down the whole rotation. Story 25. I am a nurse, but not a doctor. I had a patient who worked in a hospital, janitor, so he knew enough to fake a bit. He was seeking pain meds, complaining of chest pain, wanting morphine. He was worked up for everything cardiac and was fine. Then he tried to claim GI discomfort when he was being discharged. Cleared again for everything. Faked chest pain again. Cleared again. Now he's my patient. I'm a new face. He's telling me he's having abdominal pain. I call the doctor, knowing this guy's history. He says he'll be up to see him soon. This patient wants a ginger ale, some stomachache. I decide to go to lunch. My coworker comes into the lunchroom, disgusted. This guy had taken a dump in a basin and then dumped the ginger ale over it and tried to tell her he'd had fecal vomiting. He obviously needed Dilaudid right now for the pain. I walked into his room and sure enough, a pile of shoot in a puddle of ginger ale. I told him I'd have to take away his food and drinks and we'd have to put an NG down. Suddenly, he changed his tune. He admitted to faking it. Why do these people do what they do? In the story, opioids. Answer. I got fentanyl once in post-op, and I went from, "Holy shoot, this pain is eliminate me," to, "Please let me take a nap." That substances is incredible. I had a bottle of Percocet prescribed at home for recovery, but after that, I didn't even crack the seal and stuck with following the directions on a bottle of acetaminophen. I totally understand why those substances are so addicting, and it scared the absolute shoot out of me. Story 26. I had a patient when I worked in an ICU that was sedated and on a vent. A family member showed up out of nowhere and was staying day and night. I got pretty suspicious of them because they were clearly lying about knowing this person. Just talked to the fake family member about how it must have been sad since they just celebrated their birthday a week or so before getting ill. This person said it was a wonderful party and such, to which I replied their birthday hadn't occurred yet and wouldn't for months. Turned out when security came, it was a homeless person who snuck in and found a room with a sedated patient and decided to make it a place to stay. Needless to say, security to enter the ICU was absolute shoot. Story 27. Radiographer here. I was X-raying a guy in his 30s who claimed that he has fallen down a hill and broken his leg. He crawled to his father's garage, which was apparently by said hill, and laid on the floor for 3 days until his father found him. This was in the heat of summer, 30°C plus, and yet somehow this guy smelt fresh as a daisy. No BO, no urine, no feces. He moaned and groaned the whole way through the exam, except when he thought we couldn't hear him. He somehow managed to get a 2-day hospital stay out of it. Nothing wrong was found. Story 28. My EMT instructor told me he and his crew ran on a seizure call. Gets there, doors wide open, female patient is unconscious and buck-jerk naked. They start assessing her while one guy clears the house to make sure no one else is inside and get something to cover her. After doing an arm drop test and trying to check her pupils, they all figure out that she's faking her illness. However, their general policy was never to openly state that, but to just roll with it instead. In line with that, he starts to call for an ambulance to come take her to the hospital. When one of his guys says, "Captain, she's clearly faking it," then this woman, who is supposed to be unconscious and unresponsive, says, "No, I'm not." Story 29. Not a doctor, but am a UK-based midwife. Had a patient who had been in and out of hospital throughout her pregnancy with episodes of heavy bleeding. This was her 6th baby, so she was a fairly well-known patient in our unit. The issue was, no one had ever seen her actively bleeding. Shed call saying that she had bled down the toilet, but flushed it, and all the examinations we did came back completely normal, with mostly no evidence of any bleed whatsoever. On occasions, during speculum examinations, we'd see the smallest amount of blood. I was caring for her during a shift where she yet again called to say she was bleeding, walked into her room, and found her jabbing around her female body part with a sharp object to make herself bleed. She had been doing it the entire pregnancy. The reason she gave? Because she had 5 noisy children at home, needed some rest, and knew we wouldn't admit her to hospital if it wasn't for a good reason. She would do it any time her being discharged home was mentioned. We ended up having to complete a perinatal mental health referral and consult with the safeguarding midwives as she was putting herself and baby at risk of serious harm. Edit. So this got a lot more attention than I ever expected. There's a lot of questions regarding birth control and questioning her parenting, so thought it best to add an edit. This patient was not, by any means, a benefit seeker. They were a hard-working and loving family that had full-time jobs. She had been booked in to have her tubes tied, but found out a week before the procedure that she was pregnant with this baby. She just couldn't cope during the pregnancy and became very mentally unwell. She did not realize the implications or understand the face that she was causing massive harm to herself and her baby. She was referred to our perinatal mental health team and treated for psychosis. They also had a lot of input after she had her baby. She ended up having a C-section and was sterilized at the same time at her request. By all accounts, she is doing very well now. Also, thank you very much for the slivers. Story 30. Audiologist, hearing specialist. Have worked in private sector with legal claims and with the VA handling veterans' claims of hearing loss. With those two populations, having people faking hearing loss is pretty common. Now, as a professional, for me, the hearing test starts when I call the person's name from the waiting room. In a normal voice, I call them. If they answer, I already know that they're normal, no worse than mild loss. This was the case with this guy. He answered and came in. We had a normal conversation. So, case history over, time to test. I give the instructions over the headphones at a reasonable 50 decibels, dB. Raise your hand when you hear the tone, 50 dB tone. Should be easy and clear, but he doesn't raise his hand. I go up and up and up. Finally, I'm putting a 100 dB tone in his ear. He's flinching from pain, it's so loud, but he doesn't raise his hand to indicate he's heard the tone. Even with re-instruction, I immediately know what I'm dealing with. I have taught entire classes on how to spot and try to get estimated true results from people trying to fake it. Long story short, I wrote a darn report outlining all his inconsistencies and faking behaviors. The thing that made this one so memorable is that we had such a a pleasant conversation before. He was a fire chief. I have firefighters in my family. It was one of those where you think, if it wasn't for professional, patient-appropriate distance, we could hang and be friends. But then, this guy was determined to get a disability rating, and it just pissed me off. I have other stories in case anyone is interested, but it's likely this comment gets buried. Story 31. Had a woman bring in a kidney stone she passed and said she was in agony with another stone. She ramped up the analgesic ladder until she was on opiates, pethidine most likely. All he scans came back negative, and we had the stone she brought in analyzed. It came back as being quartz, not a mineral that occurs in the body. When confronted with this fact, she quickly left. 6 months later, and Id rotated to another nearby hospital. A woman came in with abdominal pain, and I went to see her. We locked eyes and instantly recognized each other's. I said nothing, but she knew the jig was up and self-discharged. Story 32. Guy came to ER, I was a nurse at the time, for stomachache. When asking him about history, he randomly mentions a fight with his girlfriend where she left in a tizzy and he fell asleep on the couch. 20 minutes later, when we see the CT, he has a satellite cable remote wrapped in a condom lodged in his rectum. I suppose he intended to frame her. Didn't get to hear the conversation he had with the doctor. I was curious how he was going to explain why she was nice enough to wrap it in the condom. Story 33. I saw some real terrible Munchausen's via proxy. A young teen was heavily germophobic and has nervous, obsessive-compulsive tendencies. Very paranoid and always thought he was sick. Turns out, his mother was not only encouraging this, but actively shaping it by excessive discipline if the teen's room was not spotless, subjecting him to scalding bathes and such. Not necessarily faking it, but he definitely wasn't sick. He just had a monstrously sick mother. Story 34. Pseudo or psychogenic seizures are an interesting phenomenon. Had a patient once seizing who I sternly told to stop. They proceeded to keep seizing while yelling at me, "I can't stop, I'm seizing." Pro tip, can't have a grand mal seizure while having a conversation. Edit. To address a couple comments, absolutely, psychogenic seizures are not voluntary and carry a high morbidity. In retrospect, I should not have included that term with the story I described, which was likely someone malingering for gain. Benzos. Story 35. When I was in prison, there was a guy who wanted to go to medical range, because it isn't as strict as a regular range. He told the doctors he felt like he was having a heart attack. They called for a medical emergency, and people came rushing into the range, and we got locked down. He pretended to fall on the ground, and the prison's doctor came strolling in, not hurried at all. When he came in, he came over to the guy laying on the ground and put his fingers on his neck and said, "I can't feel a pulse." The guards looked scared, and the doctor opened his bag and took his clipboard out and started tapping on it and making other noises and yelled out, "I'm going to shock him." The guy immediately sat up and started to fake gasp. I think he was holding his breath. And then the doctor was like, "Fucking idiot. Put him in segregation on tragic end watch and make sure he's being checked on in quarters." Just to be clear, tragic end watch sucks. You get absolutely nothing in your cell but a dress made out of rip-resistant fabric. He was there for 2 weeks and didn't try any shoot like that again. Story 36. I always had a hard time lying, probably due to being on the spectrum. So when I wanted to get off school as a kid, I'd always would hit myself in the stomach with my fist to not be lying about having a stomachache and wanting to go home. Looking back at it, they must have thought I was a victim of horrific bullying, but nobody ever said anything about the bruises. Looking back at it, this is horrible in so many ways. Answer. Full disclosure, I have never told anyone in my life about this, and I will edit this comment tomorrow. I've, details of incidents removed, to get out of going to school, work, other things, between the ages of 15 and 19. Depression can be a righteous meanie when you don't know what it is and that you have it. Looking back, that was also horrible in many ways, but sometimes you just cannot think of a rational way out and just go for whatever irrational idea does come up. Edit. I have decided not to delete the entire comment, but rather just take out the details, seeing as it helps knowing you're not alone. I am doing much better. This is all from over 6 years ago. Therapy really does help, if anyone is wondering. Story 37. When I was a kid, I would plan my sick days way ahead of time. Had an old thermos that I would pour leftover milk, meat, whatever. Leave it on the windowsill in my bedroom, just letting it fester for a month. Of course, the thermos was closed, so no smells escaped. I set an alarm for the middle of the night, dumped the contents of the thermos on my rug, and ran in to tell my dad I was throwing up and so sick. However, this thermos monstrosity filled the entire condo up with horrible smells, and both me and my dad ended up puking into the tub at the same time every time we tried to clean up the rug. He had to take the day off work, too. Needless to say, I never pulled that again. Story 38. I'm an ICU and ER nurse. We get a lot of malingering in the ER. One day, one of our frequent flyers came in and started faking a seizure in triage. Now, obviously, I know this lady, and she's fake seized a million times before. But this time, it's in the lobby, in front of about 30 people who have no way of knowing that it's fake. She's lolling around on the floor, making a darn fool of herself, and folks look horrified. I walked up to her and said calmly, "Karen, what are you doing?" To which this genius responds, "I'm seizing." I told her to stop seizing, so she did. Edit. No, her name wasn't actually Karen. I just did that for confidentiality. So I'm casually talking to him, telling him what we're doing. I do this with patients that can hear me or not. Then I tell him we're going to raise him up in the bed and go to put an arm under his shoulder to move him. He looks at me and says, "I can do it myself," proceeds to move up in the bed, then continues his seizing. Bless his heart. I hope he gets the help he needs. Edit. Yes, the bless his heart is sincere. Mental health is a drastically undertreated, not addressed aspect of our medical system, and I have great compassion for these folks. Yes, this has to be treated as a real seizure until proven otherwise. In case it does happen to be real, thanks for everyone that brought up pseudo-seizures are antiquated, and NES, or psychogenic non-epileptic seizures, is much more accurate, meaning not having changes in brainwaves consistent with epilepsy on EEG. Also, sternal rubs are very painful and are used sparingly when it is necessary to ascertain a patient's state when powerful interventions depend on the information we are able to rapidly acquire. Not something to be taken lightly. Anyone with PNEs, there are clinics that can help you. Please seek out help. There is no reason to be ashamed, though ignorance and judgment in any field. Story 39. ER patient registers with chief complaint of dental pain, allergies to every known NSAID. Yes, I know this can actually be genuine, such as with AERD. This is a small, rural hospital, so I happened to see this guy go across the hall to the lounge and help himself to a big mug of hot, black, hospital-quality coffee and proceed to drink it in the waiting area. On asking about the dental pain, he reports that the pain is severe and worsened by drinking cold or hot liquids. His head and neck exam is non-acute, and he is discharged to home with instructions for supportive care including ice packs and follow-up with his dentist ASAP. His dissatisfaction is loud and salty. Answer: I am allergic to aspirin and ibuprofen. Thank God Tylenol is still good. And I dislike even bringing it up to doctors, because I always get a look when I do. Luckily, I've only had a couple of medical issues that I was able to get by with no extended pain management, C-section, and IUD placement. But I worry if I'll be taken seriously if it comes down to it. Story 40. ER nurse. Bringing a patient back to a room who said he had kidney stones. I had him stop at the bathroom and get a urine sample. Dude comes out with the specimen cup that literally has a piece of concrete in it. Looked him in the eye, expecting some sort of joke. He was serious. I threw it away and walked his dumbass back to the waiting room to contemplate his stupidity. Answer: my next-door neighbor would drink a 12-pack of Mountain Dew a day and keep kidney stones year-round to get pills. He had a pretty sweet deal, too, getting 90 Loracets, 90 Xanax, and 90 something else, I forget, every month from his doctor. He just couldn't stop doing other substances and pissing dirty. I tell this story just because I was impressed with his determination to hurt himself and get surgery once a year just to get high. Like the absolute determination that takes. My mother is a recovering addict and had been getting the same pills around that time, and I don't recall her intentionally hurting herself. She just went with already messed up issues before she got herself into a clinic to get clean. Edit. Thanks for the gold, man. Who knew talking about my former junkie neighbor would get me gold? If you're reading this, Jerry, you had to know this was about you. Love you, man. Hope you get your shoot together. Story 41. When I was a medical student, I worked in the pediatric side of the emergency room, and we would give popsicles to all the kids. One afternoon, an 8-year-old came in with his father, and I asked what was wrong. The kid couldn't remember what he complained about to his dad, and the dad couldn't remember why he brought his kid in. The kid's mom was a nurse. She was working at another hospital at the time, and she was the one that would keep track of these things. Anyway, after a few minutes trying to figure out what was going on, the kid asked, "So, can I have my popsicle now?" The kid was 100 healthy. Unfortunately, we reinforced bad behavior, and both the kid and the dad subsequently left with popsicles. Answer. When I was in preschool, I got a ribbon for good behavior. For some unknown reason, idiotic 3-year-old me decided to stick the safety pin from the ribbon up my nose, and I couldn't get it out. Neither could my parents. So, off to the pediatrician's office. Since it was nearby, my dad bundled me up, put me in the stroller, and walked there. Since it was winter, the cold air ended up opening up my nostrils, and the safety pin came out when we got to the clinic. Nevertheless, they offered a coupon for ice cream, and my dad was having none of it. No way were they rewarding my stupidity. Story 42. Patient faking seizures, so doctor was taking a history. Doctor. Double vision? Patul. Yes. Doctor. Close the left eye. Still double vision? Patul. Story 43. Physical therapist here. Working mom comes into the clinic with her infant in a stroller. She's limping like she's got a nail in her foot, wincing in pain and tears in her eyes. She's crying during her visit with the PT. None of us think she's faking it. She limped out of the clinic. I glanced out of the window and saw this woman bounding down the sidewalk, hips swaying, full stride, going places. We were all fools. Story 44. I'm a surgery resident. When I was on my trauma rotation, we had a patient come in after an MVC with a question that maybe the patient had seized and that had caused the accident. So he's in the trauma bay and starts shaking. The trauma nurse goes, "Oh, this isn't a real seizure." And the patient stops shaking, sits up, turns to the nurse, and yells, "You don't know a fudge thing about me." Story 45. My mom was an emergency room nurse. Years ago, they brought a prisoner from the local pen in who seemed to be unconscious. The guards were suspicious that he was faking it. They checked his vitals and everything seemed to be okay. The attending doctor tried poking him in the foot with something pointy. Nothing. Then he got an idea. They took a rubber hose and inserted it in the back of his throat, as if they were intubating him. That did the trick. He sat up very quickly, coughing and gagging. Edit. Yes, sternum rub. Got it. Answer. There's an even easier way. Just take their hand, hold it over their face, and drop their hand. If they're truly unconscious, or tipsy, or very out of it, etc., they'll smack themselves in the face. If they are conscious, they will always do something to lessen the hit, like make their hand land to the side, or they turn their hand and hit somewhere they think it won't hurt, etc. Edit. Okay, so apparently you shouldn't do this. Don't do this, guys. Edit 2. Seriously, don't do this. It's bad. Story 46. 30-year-old woman came to the ED with such excruciating belly pain, paralyzed. Oh God, it hurts when you press there. Must have oxycodone now. ED doc said if she can get out of the ED bed and do 20 jumping jacks, we can give her the oxy. She did 20 jumping jacks, then got kicked out of the ED. Answer. Sounds like the woman who came into my dentist's office while I was working reception, sobbing frantically and saying she'd broken a tooth and was in agony. Wouldn't let the dentist examine the tooth, just demanded that she needed something for the pain. She got kicked out pretty fast once the dentist managed to get a look and said it was broken, but it was an old break and didn't even come close to the nerve. Story 47. Not a doctor. I do work in medicine. Saw someone come into the ER and after throwing themselves downstairs for opiates. Miraculously, they were fine, except they completely fudged one of their knees. We offered them physical therapy and a knee brace. They were extremely unhappy. Story 48. Whenever we had kids, usually teenagers, playing up their symptoms to extend their hospital stay, we would order them into a healthy lifestyle. Lights out at 9. No screen time for 2 hours before bedtime. Healthy diet chock full of fruits and vegetables. Screen time limits. Minimum number of laps around the unit per day to get in their exercise. They got better so much faster with our healthy lifestyle tips. Story 49. Here is the opposite scenario. I went to the emergency department for the second time. Incredible stomach pain that I couldn't place. The nurse casually offered me Oxy and looked really surprised when I turned them down, saying that it won't fix this pain in my stomach. Like they were expecting me to be like, yeah, that's the reason I'm here. Story 50. One time my roommate, who is an ICU nurse, came to see one of my indoor soccer games. During the game, a player on the other team went down hurt and started screaming in pain and swearing and rolling around while holding his ankle before he was eventually helped off the field. He then limped over to where the fans sat and watched the rest of the game, brooding in silence before he left early. After the game, my roommate told me he was going to go over and see if there was anything he could do to help, until he saw that the guy was limping on the wrong leg. Story 51. Even for the malingerers, too. They're usually in a terrible place in life, despite how much fun it is to read about their stories. We should treat both types of people with compassion and understand the circumstances that brought them to that place in life. I totally had a patient who nearly eliminated herself injecting her own poop into her skin, though. That was pretty wild. Answer: this. Don't get me wrong, when it's stressful and we are out of space, providers and nurses are maxed out, it's really hard not to be completely irritated by a regular or someone who doesn't understand their ailments are not a medical emergency. But yes, we should be compassionate because who knows what trauma led them to where they are today. And fortunately, our brains could cope differently so we could help the people who can't. I've also come to realize that in the ER, I'm just here to help them today. I can't fix their emotional trauma, but I can be kind to them today. Edit. Thank you for the Silver and Wholesome Awards, Reddit strangers. Story 52. Nurse for an ophthalmologist here. Had a 21-year-old new patient claiming to be completely blind from a sudden and severe glaucoma diagnosis from a previous unknown doctor. Would feel around while walking. Tried to keep eyes rolled back into his head, the whole 9 yards. He said he is a famous YouTube rapper that is now unable to make videos or earn a living. I exclaimed to have heard of him before, and very excitedly asked him to search and show me his YouTube channel on my phone so that I could subscribe. He took my phone out of my hand and effortlessly found the YouTube app and typed away in the search bar. Oh, and of course, his eyes were back to normal and focused. Story 53. Not a doctor, but worked in healthcare for nearly 20 years. While taking a break from the ICU, due to it being emotionally draining, I worked in home health for a bit. I had a patient who clearly had Munchausen syndrome. On a daily basis, she would call her insurance to see what things would be covered if she was diagnosed with this or that. She called her doctor's office an average of 5 times during my shift with her. She would report all kinds of non-real symptoms. She pestered the doctors into do exploitive laparoscopic surgery. Of course, nothing was found. One day, I walked in and she was rubbing her incisions with rotten cabbage, trying to get it infected. She wasn't seeking pain meds, except to sell. Really, she was just as happy with antibiotics or stool softeners, anything, as long as they wrote her a prescription and she got to go to the pharmacy, where she did a whole song and dance for them too, claiming allergies and reactions. She always increased the exaggeration of her story too. One time she fluttered her eyes after making sure I was looking and said she lost consciousness in that half a second. She called the doctor and claimed she lost consciousness for 5 minutes. She called the insurance and claimed it was 10 minutes. She called the pharmacy and claimed it was 30 minutes. Then she called 911 911 and told them she woke up on the floor after losing consciousness for 4 hours. The worst thing about her was she was a mom. Her son was 28 at the time, and by all the stories of his childhood illnesses and all her saying how he is severely disabled, I knew she basically fudged up his childhood with Munchausen by proxy. She portrayed him as being severely disabled, and that's why he would never find a wife. I met him. He was healthy and of average intelligence. He wasn't looking for a wife. He was gay, but she refused to accept that. Working with her was so miserable that I took a couple years off from any and all healthcare after that. Answer: this is exactly like The Act, if you haven't seen it, except the mother with Munchausen's was only claiming all of the illness on her daughter and was drugging her to make her believe she was sick too, under the guise of medication. She used her daughter's sickness to receive charity and publicity until things went south when her daughter figured things out and flipped shoot. Story 54. Not a doctor, but I was in the ER one night, and there was a seeking substances addict who literally only acted in pain when there was staff around. You ever see those videos where the little kid is fine, and then they spot a parent, and then bawl, then immediately stop and be fine when the parent is out of view? Exactly like that. Sat fine. No movements or wincing or noises, then wailing when a nurse was in the same vicinity, then back to fine when they left. Answer: a few weeks ago, I had a vulvar biopsy. I was petrified of this procedure, and I didn't know how to ask the doctor if I'll be given pain meds because of people like this. There is no way to even frame the question without sounding like a substances seeker. I ended up not needing anything at all, but still. Figure it's a legit question, but you can't ask it. Story 55. Taking trauma call during surgery residency. Had a prisoner come in after a fight and claimed he couldn't move or feel his legs. All the CT scans and MRIs were normal, but we would shield his legs so he couldn't see them and poke them with needles and other sharp objects, with enough force to cause pain. He never flinched or moved his legs at all. He was diagnosed with Skywara, spinal cord injury without radiographic abnormality. He stayed in the hospital for a week. No improvement. Always had one guard with him. One night, they were down in the lobby watching some television, but the guard needed to use the restroom. The patient said, "Where could I possibly go? I'm paralyzed." Guard left him alone for 2 minutes. Patient, last seen sprinting down the road, naked butt cheeks flapping in the breeze. Made it to a city 4 hours away by car before he was caught again. I have never seen anyone fake it so well. Truly playing the long con. Story 56. Had a patient when I was an intern feigning blindness. She would constantly be playing on her smartphone, only furiously trying to hide it when someone from the care team came into her room. The best was when my attending one day strolled past her room and threw his hand up in a highly exaggerated hello wave. She started to throw her arm up too, but caught herself halfway through, then threw her hand back into her lap and pretended to be staring off into nothing. Story 57. Patient and a family member coming in stating that patient has epilepsy and needs benzos. While gathering basic history, the patient starts having a seizure, rolling on the ground, head shaking, and feet kicking. I asked the patient if he needed any help during the seizure. He responds back, saying he is experiencing a seizure. Family member is obviously trying to convince me that patient is having seizures like this every day and needs benzos. I kindly told patient and family member this is psychogenic, non-epileptic seizures, and he needs to see a psychologist for an evaluation. They had a hard time believing this condition and walked out. Story 58. Not a doctor, but a nurse. Once had a patient having a seizure. The other ER nurse and I knew she was faking it. He said as much. She suddenly stopped seizing, miraculously, looked straight at him, and yelled, "Shut up, fat boy!" He and I laughed so hard. He, the other nurse, was referred to as such, fat boy, for a few months after that. At least she wasn't having a seizure. Edit. Spelling clarification. Answer. My wife works in a hospital, radiographer, and some of the nurses have told stories of those who fake being unconscious. Apparently, a couple of surefire ways to check this are knuckling the sternum or knocking on a clavicle without warning. Then there was the amusing story she heard, where a nurse said out loud, "You know that even while unconscious, a person will reflexively not let their hand hit their face," and proceeded to lift the patient's arm and drop it over their face, to which the unconscious person stopped their hand in midair.
Yup.
Story 59. I'm not a doctor, but a nurse. There was a geriatric patient taking advantage of the call bell because she was an attention seeker. She always needed really basic things to get done for her because she thought the place was a hotel. It was a rehabilitation ward, and we should try to motivate patients to do as much for themselves as possible. She would ring the bell for reasons like, "Please lift the blanket up for me," or "Please pass me my phone," or "Please feed me," and claimed that her hands didn't work. I caught her several times lifting herself off the bed with her hands, grabbing her phone when it rang. You get the gist. After days of saying no, and that she needs to start doing things for herself, she grew more and more frustrated. Eventually, she snapped, grabbed me by my collar, shook me aggressively, and yelled, "What don't you understand about the fact that my hands don't work?" I didn't know what to tell her. I just looked at her and blinked as she slowly released her passing grip off me. I guess I healed her hands. Praise the Lord. One upvote, one prayer for an old lady's arthritis. Story 60. I'm an EM doc. Lots of weak pseudo-seizure stories. Those are fairly common. Some of those people are straight up seeking IV benzos. But most are people with seizure disorders who have some psych issues and are coming by it honestly. They're just sad, confused people who don't know how to handle stress for the most part. I've seen all sorts of weird people faking symptoms. The most devious was a guy I'll call Steve. Steve had to be in the medical field somehow. Probably a nurse or tech. He was fairly tall and skinny. He claimed to have Marfan syndrome, a rare connective tissue disease that makes you tall and skinny and puts you at a higher risk for an aortic dissection. You can think of aortic dissections as the main pipe carrying blood starting to break. They're bad. Steve didn't only claim to have Marfan's. He stated that he had a dissection in the past, and it was done by Dr. BFD at BFD Medical Center. Real surgeon and real institution. I'm removing the name. He then would come in with a classic story for dissection. He'd say he had a tearing chest pain radiating to the back. Steve took it to the next level. He'd flex his arm when the blood pressure cuff was on one arm, then relax on the other. This caused vastly different blood pressure readings in each arm, and this is another classically taught finding in dissection. In addition to this, the bastard would say that he had an anaphylactic reaction to contrast dye. He did this in an attempt to force us to pre-treat him with Benadryl and steroids, which took 8 hours. During those 8 hours, he'd request opiates after opiates before getting his CTA done. He also would get nauseated, requesting Phenergan. For those who don't know, IV Dilaudid, Phenergan, and Benadryl is the best ride the hospital can really put you on. They all potentiate each other. Highly reviewed by opiate junkies everywhere. I got Steve on his 3rd visit. The 2 prior visits showed no dissections. Steve was dumb enough to come in during normal business hours, and I managed to get a hold of this surgeon. Surgeon said he'd never taken care of the guy, and that he'd gotten multiple calls about him. I still offered the CTA to the patient. I told him he'd be getting 0 opiates, though. He left in a fit. Fudge Steve. No one has seen him since. I'm sure he's at some new hospital now. Story 61. Had a patient come in for a fall who now couldn't move their legs at all. Did a bunch of tests, didn't find anything. The patient was not at all fazed by suddenly being paralyzed, which was the first red flag. Didn't really believe anything was wrong, but the patient was still not moving their legs. My options are to admit for a huge workup or get them to walk. So I update them saying everything is fine, tests are negative, you can go home. Patient gets up, gets dressed, and walks out without a word. Answer. When I was a kid, something heavy fell on my head. I was at theater rehearsal at the time, so of course I didn't tell anyone, and no one saw. And between the pounding headache and hot stage lights, I passed out. I woke up 30 seconds later and couldn't move my legs, couldn't even wiggle my toes. My dad was already there to pick my aunt up and brought my aunt straight to the hospital. Did some tests, and my year the time everything came back perfectly fine. I could wiggle my toes. I was discharged and was able to walk, very slowly and with a lot of support from my dad, out. Went to my pediatrician the next day, who thought it was some sort of side effect of a vasovagal attack from the stress of the falling object in the rehearsal. Very odd. Story 62. My cousin got glasses. Her 7-year-old little sister also wanted glasses because she thought it was so cool to wear them. So she started telling her teachers she couldn't read what was on the chalkboard, and she'd squint at home and go incredibly close to the TV to watch things because she said she couldn't see things clearly. Her parents got worried and took her to the doctor. She read everything wrong on the vision test. Everyone seemed convinced that she needed glasses. But the doctor was a little concerned because the tests indicated she needed really thick glasses. And usually that wasn't the case unless there was a family history of vision issues. Her parents both had 20/20 vision, and her sister only had astigmatism. They all realized she was faking it. So the doctor told her parents in front of her that she'd need some pretty intense eye surgery so she'd be able to see without glasses. They even wheeled in a machine to make it convincing, to say they could do the surgery right then and there. She freaked out, confessed to faking it all, and started to cry. She got grounded for a while. Answer: I wanted glasses as a small child too. Went to the ophthalmologist, purposely misread all the charts. The doctor pulled a pair of glasses out from a drawer. I put them on, read all the lines perfectly. Turns out they were fake glasses for just this situation. Frames with glass, not prescription lens. Story 63. Former scrub nurse. Patient was on the table having a minimally invasive procedure, carrying on and asking for more and more Versed and fentanyl. She was already maxed. She had a tolerance, despite claiming to have never had narcotics before. Suddenly begins yelling, "I see the light! I see the light!" Does anyone else in here see that light? 6'4" mountain of a man circulating nurse gets in her face and says, "No, and neither do you. Now be quiet and let us do our job." Patient calm, normal vitals, and resting comfortably.